This next specimen is a specimen of heart, and we chose it because it has pretty good demonstration of cross-section and longitudinal sections of striated cardiac muscle cells. This is a specimen of acute fibrinous pericarditis. Acute meaning it happened very recently, before the specimen was fixed and prepared. Fibrinous in that the reaction is producing fibrin in the tissue where it normally is not supposed to be, and pericarditis in that it is an infection that is attracting lymphocytes, monocytes, and neutrophils, and it's occurring around the heart, pericardium, or a part of the epicardium. The pericardium has an epicardium and subepicardium. So when we look at this specimen, in the annotations we have provided areas where you can find the best cross-section and longitudinal section. So first of all, in the box you'll find pretty good longitudinal sections, and you see here is a branch of a cardiac muscle cell, which is typical. You see the nucleus is in the center of the cell. Any of these flattened nuclei you see here, even if I say enlarge this a little bit more than I should, you see it's a little blurry, but you can still see you have a flattened cell here and red blood cells. That is a capillary, and those are endothelial cells. But this is a cardiac muscle cell tissue, and here's a branch, and also if you look around you can see pink staining material, such as here. If we enlarge that slightly, you can see this lipofuscin, which is really accumulation of lysosomes and organelles they have digested. Remember that cardiac muscle tissue, as a rule, doesn't regenerate, although in recent times stem cells have been found in cardiac muscle, and they can be stimulated to replace cardiac muscle tissue. The same thing is happening in the brain. We're learning more and more about that. And here's another capillary. You see just one red blood cell within the capillary. This is probably a lymphocyte in the tissue here. So, but you can go and look at the cross sections and be sure that you learn the features. I'll just enlarge this briefly here. This is not a very good cross section here, so maybe down in this area would be better. Now this is a pretty good cross section. You can see you don't have any perfect profiles, except for here you have a nucleus in the middle of a profile of a cardiac muscle cell, and here likewise. So I'm going to pause this a minute and see what's happening here. Okay, we're okay. Okay, so I just want to comment before I leave this on the pericarditis, because this is the pericardium here, and right at the edge of the normal muscle cells you have normal pericardium, which often has a lot of adipose tissue in it, and it will have cardiac veins or coronary arteries or veins, and this is a coronary vein, which most of the blood is spilled out, but you do have some red blood cells in here. But the pericarditis is here, and you can see that this pink area, that's actually accumulation of fibrin that has come out of the bloodstream, and it looks like muscle cells, but they're not. And you can see all of these inflammatory cells. Many of them are lymphocytes, so this may be a viral pericarditis, and some are monocytes. It's not possible to be, because some of these specimens were scanned at 20x, so you don't see the detail that you would like to see. But in artificially enlarged this is probably a monocyte here. It's now become a macrophage. Another one here, and all of these are lymphocytes. Okay, and this could be very well a neutrophil. You see almost the idea of a lobe nucleus, and this looks like a band cell neutrophil. You see the band shape of that neutrophil? So you'll find a variety of cells in here reacting to whatever the bacterial or viral agent was that caused this. Okay, I apologize. This has gone slightly over 5 minutes, but I think it's probably helpful information. So I'm going to stop this now and go on to the next specimen.